Hello, my name's Brian. I'm going to be your nurse today. Can you tell me your name and birth date?
Alice, March 5th, 2000.
Okay. I'm going to wash my hands. Can you tell me why you're here?
To get a checkup.
Okay. Can you tell me the month and year?
November of 2021.
And can you tell me where you're at?
I'm in the lab.
Okay. We are going to do a head-to-toe assessment today. And I would like to start by you emptying your bladder. If you could go do that for me, please. Alright, you're walking nice and straight, no limping or guarding. Your gait is good. Alright, if you'll stand for me, I'm going to check your spine, make sure it's nice and straight. Can you touch your toes for me? Same thing. And check the curve, make sure it's nice and straight. Okay, no scoliosis there. Alright, you're gonna start at your head, look at your hair. Hair looks nice and thick, it's evenly distributed, and it's nice and clean. Do you have any headaches?
No.
Any head trauma of any sort?
Nope.
And any head surgeries in the past?
Nope.
Okay. Alright, I'm going to touch your head now. I'm checking for any bumps, any sort of lesions or anything. Any pain when I do that?
Nope.
Cool. Okay. Now I'm gonna check your eyes. Do you have any vision issues?
Nope.
Do you wear contacts or glasses?
Nope.
And any injury or trauma to your eyes?
No.
Cool. All right. Can you use this pen light? I'm gonna check your pupil accommodation. All right. Accommodation is good. You look at this pin and then look far away. Alright, accommodates good. I'm going to check your conjunctivas. They're nice and pink. Alright, I'm going to palpate your maxillary sinuses. Any pain there?
Nope.
Okay. I'm going to do your eye exam now. If you'll just hold still for me. Have the red light reflex. Your optic disc is nice and orange. And all the blood vessels seem appropriate. Can you go to your nose now? You're broken your nose?
Nope.
You have any nosebleeds ever?
Nope.
And have any drainage?
No.
Okay. Your nose seems nice and straight. I'm gonna look up in there now. I see some hairs and it's pink. I don't see any drainage or any foreign objects. Your septum is right down the middle where it's supposed to be. Alright, I'm gonna move on to your ears now. Your ears are nice and symmetrical. They're even with your eyes. Just like all your other facial structures, everything looks symmetrical and good. Any hearing problems?
No.
Any pain in your ears?
Nope.
And do you have any ringing in your ears?
No.
Okay. We'll look at your exterior. There's no redness or nodules. Does this hurt when I touch it?
Nope.
Okay. I'm gonna look inside your ear. Nope.
It's from the ear.
Okay. Gonna hold it like a pencil. Gonna pull your ear up and back. Tympanic membrane looks good. No excessive earwax, no bleeding. Tympanic membrane's nice and pearly gray. Everything looks good. Gonna move on to your mouth now. How often do you go to the dentist?
Every 6 months.
Okay, you have any pain in your mouth? And you ever have any dryness in your mouth?
Nope.
Okay, lips look good, they're nice and pink, they don't seem dry or cracked or anything. I'm going to check her gums. Gums are nice and pink, they don't seem red or white. Teeth look good, teeth are all there, none of them are broken, there's no obvious cavities or missing teeth. I'm gonna check, look inside, look in her cheeks. There's no lesions or bumps or anything that's not supposed to be there. Her hard and soft palate, there's no deviation, it looks good. Her tonsillar pillars look good. There's no redness or exudate of any sort. Her tongue also looks good. It's pink and moist. No sores or anything on it. I'm gonna grab tongue blade. I'm gonna have you say ah. Uvula moves up and back like it's supposed to. Okay. I'm gonna move to your neck. Any neck injuries
Nope.
or surgeries?
Nope.
Any pain in your neck at all?
No.
Can you move it left and right, up and down? No pain there?
Nope.
Good. Gonna check your trachea. Nice and straight. Gonna feel for your thyroid. Can you swallow for me? Okay. I'm gonna check your lymph nodes now. If you notice any of your lymph nodes are enlarged.
Nope.
Or any sort of swelling or anything, any redness or any of them hot.
Nope.
You've noticed any of them go away or don't go away?
Nope.
Okay. Alright, so we'll do a check pre-auricle, post-auricle, occipital, tonsillar, submandibular, submental, interior cervical chain, posterior cervical chain, supraclavicular, we could do axillary in her armpit region, and then check her inguinal nodes down in her groin. I'm also going to have you move your mouth up and down. Any pain there?
No.
Okay, we'll check for TMJ. Lymph nodes are good. Okay, now I'm going to listen to your lungs. Any troubles breathing?
Nope.
Any shortness of breath?
Nope.
And any recent coughs?
No.
Okay. I'd watch her breathe, look for equal lung expansion. I'm gonna listen each time. I just want you to take a deep breath in, okay? Listen to her lateral thorax. Compare each side. Okay, have you turn around for me, please? Do the same thing. I have 8 spots here. Deep breath in and out, please. Okay. I'm gonna check for tactile firmness. If you could just say 99, please.
99.
And again.
99.
Last time.
99.
Alright, no extra vibrations there. Can you take a deep breath in and out for me? Alright, equal lung expansion. I'm gonna just check CBA tenderness for kidney stones. Any pain here?
Nope.
How about here?
Nope.
Okay. Turn around for me, please. I'm also gonna check for crepitus. Seems good. Alright, gonna move on to your cardiovascular. Any recent chest pain?
Nope.
Any heart issues in the past at all?
Nope.
And any family history of heart disease or anything?
No.
Okay. I would look at her chest, make sure there's it's appropriate color, there's no bruising, lumps, or anything like that. I'm going to listen to her heart now. Start with an apical and pulmonic, Erb's point, tricuspid, and mitral. I will listen to her apical pulse for a full minute. check your pulses. Start with temporal. Make sure they're nice and equal on both sides. Do carotid one at a time. Also going to check your carotid for Brury. Use the bell of the stethoscope. Okay, no Brury there. Also going to check her brachial, radial. And check her femoral, her popliteal pulses, posterior tibial pulses, and dorsalis pedis. Okay, I'm gonna have you lay down now. I'm going to assess your abdomen. Any nausea, vomiting?
No.
Any stomach pains at all?
No.
And when was your last bowel movement?
This morning.
Okay, so I look at the contour of her stomach, make sure it's all good. Make sure there's no obvious lumps or disformation, any discoloring of any sort. I'm gonna listen first for bowel sounds in all 4 quadrants. We should hear bowel sounds within 5 to 15 seconds. If not, we will listen to each quadrant for a full 5 minutes. We did. There's something going on in there.
I mean, I had pancakes at 10:30
Okay.
or 9:30.
All right, now I'm gonna do light and deep palpation. Let me know if there's any tenderness or any pain. Good. All right, I would check for rebound tenderness in the lower left quadrant. That could be a sign of appendicitis. I'm gonna assess her spleen in the upper left quadrant. We should not be able to feel this. I'm gonna go around, gonna palpate the upper right quadrant, see if I can feel her liver, make sure it's not enlarged. I could also check for tenderness here. That's Murphy's sign. If there is tenderness, it could be a sign of gallbladder issues. Now I'm going to check her extremities. Any swelling in your arms or legs?
Nope.
Any pain at all? Whenever you notice, like, you have any moles or anything?
No.
Anything that hasn't changed? Color seems appropriate for her being Caucasian. Hair distribution seems well. Skin's not dry. I'm gonna check her skin turgor, make sure she's well hydrated. Her nails, they don't seem brittle, they seem appropriate color. There's no clubbing, so she's well oxygenated, and her cap refill is less than 3 seconds. So now I'm gonna move to her musculoskeletal while she's laying down. I'm going to have you lift up your right leg. Any pain there?
Nope.
And your left leg, any pain there?
Nope.
Okay, good hip strength and mobility. I'm gonna lift your leg, we'll do McMurray's sign. Any pain here?
Nope.
Don't notice any cracking or anything. Can you, we'll do human sign. Can you, any pain there?
Nope.
No sign of DVT. Okay, you sit up for me. Lower you a little bit here. Alright, squeeze my fingers. And move your arms up and down. Okay, put your arms out. Push up. Okay, rotator cuff's good. Do this, the Phelan sign. Any pain there?
Nope.
We'd hold that for a full minute. That could be a sign of carpal tunnel. Gonna check, do the near cess, go up and in. Any pain there?
No.
Okay. Rotator cuff is good. Have me push up on my feet. It's good. I push up on my hands. Any pain when you walk or do anything? Any sort of surgeries?
No.
And any swelling in your joints?
No.
Okay, I'm gonna check your knee. See if there's any sort of bulge there. Now I'm gonna stabilize your knee with my knee and pull. Any pain there?
No.
How about here?
No.
Okay. ACL's good. Let's see here. Musculoskeletal. I think we've done everything there. I'm trying to think if there's anything that I'm missing with musculoskeletal. You squeeze my hands, you did shoulders. Okay. Oh, reflexes. I'm gonna check your reflexes now. Alright, you're gonna check tricep reflex. Oh, okay. Your brachial, or your bicep and my thumb. This is the brachial radialis. Good. Check your patellar and your Achilles. Awesome. Now we're gonna go to neuro. Any head injuries?
No.
Trouble with memory?
No.
And have you ever had like a seizure before?
No.
Okay. First thing I want you to do is we're gonna check your motor function. We're gonna pronate, supinate super fast. Take your fingers like this, touch them to your thumbs each time. Alright, I want you to touch your nose and then touch my finger. You're gonna move it. Questionable. Alright, heel to shin. Good. Okay, I'm gonna have you stand. I want you just to walk heel to toe for me a couple steps here. And back. Okay. I want you to stand, close your eyes, put your arms out. Feel dizzy, you're about to fall. No? Okay, good. Let's sit back down, please. Alright, I'm gonna do sharp and dull sensation. If you'll close your eyes for me. Tell me if this is dull or sharp.
Dull. Sharp. Dull. Sharp.
Okay. I'm gonna place this object in your hand. Can you tell me what it is?
Paperclip.
Cool, perfect. I'm going to draw a letter in your palm. Can you tell me what it is?
T.
Perfect. Okay. Do you do breast exams at home?
Yes.
Okay, how often do you do them?
Once a month.
Okay. And do you do them at the same time every month?
Yes.
Okay. And you know to check the upper outer quadrants, that's where they find most breast cancers. And if you were to find something, you should know to contact your doctor.
Okay.
Okay. Now I'm gonna do your cranial nerves. So for cranial nerve, number 1, take an alcohol swab and have you smell it. Can you smell that?
Yes.
Okay. For number 2, gonna do a Snellen chart, which we won't do today. For 3, 4, and 6, do your cardinal field. So if you want to follow my finger. Okay. For 5, I'm gonna have. Does this feel the same on each side?
Mm-hmm.
Okay. I would also take a cotton swab, touch it to your eye for corneal reflex. 7, you raise your eyebrows, close your eyes real hard, smile, puff out your cheeks. Okay, for 8, gonna do the whisper test. Over your ear, can you say,
Hi, Wendy.
perfect. 9 and 10, we'll check your gag reflex. And for 11, I'm gonna have you raise your shoulders and push against my hand. Push against it. Any pain there?
Nope.
And for 12, I'm gonna have you stick out your tongue. Okay, any questions?
No.
Okay.